As is the case with any client, the first step in program development for clients with Down syndrome is to understand the individual's goals and perform some baseline assessments. In general, most common fitness assessments are appropriate with some modifications to ensure safety and understanding. One unique aspect of this population is the engagement of the caregiver in the health history conversation. Find out about any previous adverse experiences in the gym. Once you know what exercises you want to prescribe, we can look at how to organize a session. The flow should have an athlete feeling successful through a combination of preferred and non-preferred exercises, and transition time should be minimized to accomplish as much work as possible in a given amount of time. We want to use a combination of visual and verbal instruction to address different learning styles, but it's important to constantly reflect on your instruction and ask yourself how clearly and concisely you were able to communicate. There are specific exercises and approaches that may be most effective for individuals with Down syndrome, but the environment that you create in the delivery of the training session is likely more important than the intricacies of the program design when it comes to training outcomes. All of our sessions follow a similar structure of dynamic warm-up, speed and power work, primary and secondary strength, accessories, and then either conditioning or single joint exercises. Which exercises you fill each bucket with is determined by the client's ability, experience, and fitness level. During a dynamic warm-up, our main goal is to perform movements that elevate body temperature and get muscles moving through an appropriate range of motion. As we previously mentioned, we want to focus on stability and motor control, as opposed to mobility and flexibility, the latter of which most of these clients will already possess more than enough of. It's our responsibility to help them have strength and control through those ranges of motion. You can also spend some time during the warm-up to communicate the expectations for the session. Some clients will benefit from having a period of time to acclimate to the environment and a clear understanding of what's expected of them. The warm-up doesn't necessarily have to be a series of unique mobility and stability exercises. Sometimes the best warm-up is preparing unloaded or regressed variations of the primary exercises to prepare the athlete for the demands of the main portion of the workout, or get some additional cardiovascular conditioning in. We can distinguish between rehab and prehab exercises. As personal trainers and strength and conditioning coaches, it's beyond our scope to function in a rehabilitative manner, but we can choose specific exercises that are geared towards the prevention of common injuries or issues associated with the diagnosis. The exercises are similar in nature, but the desired outcome is slightly different. However, if you're going to incorporate these lower-level prehab exercises like clamshells, step-downs, calf work, and rotator cuff drills, we want to make sure that they don't engulf too much of a client's training time to the point where there isn't much of a strength conditioning stimulus. I think it's a bit of a fallacy that some exercises are strength exercises and others are labeled as stability. Sometimes fitness professionals just consider exercises that are challenging on a client's balance or a single joint exercise that works a small musculature that supports a joint as stability exercises. These definitely have a place in a program, but we want to make sure that they don't account for more than a quarter of a client's training time. For some clients who are relatively deconditioned, you might need to start here, but hopefully you would progress to more challenging patterns over time. Our recommendation is to keep the warm-up to about 5 minutes of a 60-minute session, possibly 10 to 15 minutes if you're including some form of cardio like an Airdyne bike or rowing machine. After the warm-up, we usually progress to speed and power work if it's part of a client's program. It's best performed earlier in the session in the absence of fatigue. In this section of the program, we might incorporate ballistic movements like medicine ball throws, or lighter exercises performed with more velocity. But we want to make sure that the cognitive demand is appropriate so that the effort can be high. For our primary strength exercises, we'll choose 2 to 3 compound movements and try to progress them over time in a few different ways. 1, performing them with less assistance. 2, progressing the difficulty of a movement pattern. For example, starting with an incline push-up to a barbell, progressing down to a bench, and ultimately working your way towards the floor. And we can add load or increase the number of sets and reps. We can increase the range of motion, provided it isn't feeding into hypermobility patterns, or lastly, add tempos or positional pauses. Once we've chosen our primary compound movements during the accessory section of a program, we're typically addressing whatever movement patterns haven't already been addressed, or we're trying to address a specific physiological characteristic of the diagnosis, or a specific performance goal or health need. For our strength and accessory movements, we'll often incorporate constraints to make sure that the correct stimulus is achieved. In the last section of our program, we'll typically have either single joint movements, which can also be placed in the accessory section, or conditioning options. We want to see our conditioning work consist of about 70 to 80% lower intensity work, whether that's running, walking, an elliptical, or a rowing machine. High intensity intervals should be gradually introduced as an athlete's work capacity improves, provided it doesn't interfere too heavily with their enjoyment of the training session. You should be able to recall from a section earlier on cardiovascular performance what considerations should be accounted for with this population specifically. We have to determine the desired intensity and the modality that will allow the client to achieve that intensity, determine the duration or structure of intervals, and understand the coach's role in the execution. We have some clients who essentially need a coach right next to them to remind them to keep rowing, pedaling, etc., or who need a coach to keep track of their sets, reps, and time. and we have other clients with Down syndrome who can be told what to do and independently complete the workout. I encourage you to think critically and comprehensively when designing a program, but be adaptable in how you deliver it and make adjustments based on how the client responds.